I've said before that mental health is broad. It's beyond depression, anxiety, and bipolar, because those are some of the um, disorders that are very common in Kenya. But we have very many that we have not yet discovered or we have not yet heard about. And so, in today's uh, episode, I want to talk about the various types of mental disorder. Even though I may not mention all, I just really want to touch on some of the disorders that I know might be common here. But before I do that, let me welcome you to All Things Mental Health. My name is Jay Mwangi, and if you haven't, I would appreciate it if you will subscribe to this channel, and feel free to share this with your friends so that they can also be part of this family, and click the notification bell so that every time I post a new video, you are in the loop. Without further ado, let me jump into the topic of today: types of mental disorders. There are many, and the purpose of this video is particularly to to equip you with information so that the next time you meet somebody who is presenting some symptoms, you might be able to know what they could possibly be dealing with. And in future series or in future episodes, we will talk about the disorders specifically, and then we won't have problems, trying to help people, because what you do to somebody with depression is different than what you do with or for somebody with bipolar. So let me just begin. We have categories of mental disorders, and number one is anxiety disorders. Anxiety disorders are several. So not all anxiety is just an anxiety disorder. It has a name. The reason why the reason why these disorders have names, it's not so that people can be labeled, but so that when people are diagnosed by their mental health care professionals, the diagnosis helps guide the treatment. So the diagnosis or the terms are not to label anyone. That's why I keep saying, referring to people as people living with a certain disorder, but not depressed people, because that's like labeling people, right? We're not labeling people, we are trying to find help where it's available. So anxiety disorders are several. Like I've said before, we have generalized anxiety disorder, and this is where people feel afraid and too anxious about just about anything. Like they know that they have too much fear that they're not able to deal with, but they cannot point one thing that causes them that fear. I don't know if we can call this fear of the unknown. It's just generalized, generalized anxiety disorder. Then we have obsessive compulsive disorder, that's OCD, and this is a lot of people are very panicky. They want things to be a certain way. They don't want to see dust on their furniture. They want their books to be symmetrically organized. They want their furniture to look a certain way and things like that. But we're not talking about the disorder today. We'll talk about it another time. We have social anxiety disorder. I'll just name them, right? Then we can dive into the particular disorders at another day. We have panic disorder, we have separation anxiety disorder, we have phobias such as agoraphobia, claustrophobia, etc. And then from anxiety disorders, we have another category of mental disorders, and that's called mood disorders, also referred to as affective disorders. Mood, it's a condition that severely impacts mood, and its related functions, the mood and its related functions, such as depression and Under depression, again, we have subtypes like clinical depression or major depressive disorder. We have situational depression, etc. Then we have bipolar under mood disorders. We have bipolar 1 disorder and bipolar 2 disorder. Then we also have persistent depressive disorder. We have premenstrual dysphoric disorder, disruptive mood dysregulation disorder, etc., etc. Then we have another category of mental disorders known as eating disorders. Then under eating disorders, this is interesting. Under eating disorders, we have binge eating disorders. This is people who have to keep on eating or snacking on something every now and then, and it's a maladaptive coping mechanism. There's something the eating disorder might be a presenting problem, and when you begin to dig deeper, you find that there's an underlying problem. It's not that somebody loves food too much or somebody hates food too much. It's just that there's something that is causing a shift in their appetite, either causing a lack of it or an increase of it. Then we have anorexia nervosa. This is just not wanting food to enter your system. And so some people will go to the extremes of vomiting, causing themselves to vomit so that the food does not get digested, because they are probably afraid that they are going to add on weight and they're going to look bad, the body image or body dysmorphia. And then we have bulimia nervosa, etc. We will talk about those when we are talking about eating disorders. Then we have personality disorders. Personality disorders are I've only encountered one person in Kenya. Not actually encountered, I watched an interview of her talking about her experience with borderline personality disorder. Personality disorders are believed to be a lifetime, believed to be lifetime disorders. You have to manage them with consistent treatment and or medication. Okay, we will talk about them. There's 10 of them, and we will hopefully talk about them. And we have post-traumatic stress disorder. This is as a result of a traumatic event, and it's an inability to cope and get over a traumatic incident, and it has a subset known as complex post-traumatic stress disorder, or CPTSD, and this is as a result of continued traumatic experiences. For example, somebody who's in an abusive marriage is very, very likely to develop CPTSD. Somebody who has been in military training, they might develop PTSD, because these traumatic events are happening day in, day out. So we will look at the difference between PTSD and CPTSD, how they present and all that. Then we have psychotic disorders such as schizophrenia. So I hope that helped you today. My video today is going to be very short, but just to remind you, there is nothing, absolutely nothing to be ashamed of if you have a mental illness. It's an illness just like any other. I don't understand why when people have a physical illness they get sympathy, but when when our brain falls sick, it's called active imagination or attention seeking. No, our brain is part of us. Our emotions are part of us, just like our hands, just like our heads, just like our teeth, like our lungs and kidneys. Our brain is part of us. Our emotions are part of us. So let's normalize mental health, debunk the myths surrounding it, and break the stigma. And I believe that we will live in a much safer, more accommodating society. That's it for today. For all things mental health, I'm your guy, Jay Mwangi. Until next time, take care of yourself. Goodbye.